This is the Emergency Medical Minute, sponsored by Health One.
Welcome, everybody. All right, I have my first kind of Halloween-looking patient the other day. There was a whole family came in. They were at a Halloween party at the club, and seemingly out of nowhere from across the athletic club, a tennis ball flew and hit this nice young lady in the eye. And she had tremendous eye pain and had blurred vision. So when we looked very closely, she seemed to have some blood clot in the anterior chamber. So already, what are you thinking about potential diagnoses? What are we worried about from getting smacked by a high velocity, maybe up to 50, 70 miles per hour tennis ball? Something on the tip of your brain. Globe rupture, right? That would be a big one. What about behind the globe? Anything bad happen that pushes the eye out? A lot of bleeding. We got to do a lateral canthotomy. Yeah, so you can get like an orbital compartment syndrome, form a retroorbital hematoma, or on the lower side of things, just a corneal injury or a traumatic hyphema. So we did an exam. There was some clot in the anterior chamber that streaked across the chamber. The pupil was irregular but reactive, and it turned out that she just had a traumatic hyphema. So hyphema is when you have blood in the anterior chamber. There's kind of a grading system that you can look at to where there's grade 1 is you can just see a few red cells under the microscope. Grade 2 would be the blood doesn't go all the way up to the pupil. Grade 3 would be it partially covers the pupil. Grade 4 would be mostly covers the pupil. And then grade 5 would be the whole anterior chamber is full of blood. And anybody know what the bad complications would be from having a bad traumatic hyphema? All right, sounds good. We'll truncate this later. So you can get glaucoma, and you can get a little stranding called synechiae on your iris that causes your iris to have malfunction. And we'll have to continue this later. All right, thanks. Bye.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.